So
I have nothing prepared, right? So that's what I'm saying.
okay, that's fine. So you go last, let the other speakers speak, because
Yeah.
I'll be moderating, so to speak. So Ravi, I wanted you to come in as a speaker and say a few words, share your thoughts, and then maybe you come in at the end again to sum up, because we are going to have a breakout session of 10 or 12 minutes where the participants will be asked to just talk and converse amongst each other and come back with their thoughts, and then the summing up by you. So I think Yasmin is getting in people. Yasmin had said it'll take a few minutes to include everybody. The first 4 to 5 minutes will go on that.
Catalyst 2030 started life as a WhatsApp group among social entrepreneurs, connecting to envision real transformational change. Launched at the World Economic Forum in January 2020, it's grown into a global movement accelerating change to ensure the SDGs are reached by 2030. Fueled by passion, our 550 members working in 175 countries have collectively put in an amazing 50,000 volunteer hours, touching the lives of 2 billion people. And we're driven by values, to which we hold ourselves accountable. 2020 was a busy year, co-creating 3 reports with partners and producing one of our own. Inviting high-level guests to participate in the Catalyzing Change campaign, hosting fireside chats and expert hours, which will be continuing in 2021. To celebrate our achievements, together we placed our supporters in the limelight with the first Catalyst 2030 Awards for Systemic Change. With the blessing of the Dalai Lama, we celebrated finalists and winners in the following categories: special recognition for our early supporters, individual philanthropists, donor organizations, philanthropic intermediaries, corporate organizations, bi- and multilateral organizations, and 4 regional winners in the category of national governments. And now on to Catalyzing Change Week 2021. During this social entrepreneur-led event, we bring together diverse stakeholders in over 100 sessions to showcase their systems change efforts and the best practices that can accelerate our work in pursuit of the SDGs.
Good morning, good evening. People from different parts of the world have gathered here today. And the reason we've gathered here is because we are working towards a common goal, the prevention of world hunger. And there are many thoughts that come to my mind. Why are millions going hungry? Is there really a shortage of food? Is there enough food being produced on the planet? If enough is produced, Why is it not reaching those who are hungry? Where are the people who care and where are their voices? The COVID pandemic has exposed the chilling truth. We cannot hide our heads in the sand anymore. It's like seeing your reflection in the mirror in the pitiless light of the day. And what is the truth? Health inequalities, nutrition inequalities, starvation deaths, terrible injustice meted out to those who are already burdened under the yoke of deprivation. And these are not mere words. Let's not talk of numbers, and let's not just talk of COVID deaths, which are so important. But what about the starvation deaths? This is why we are here today, to shed the spotlight on this burning issue, to ponder and to discuss how we can move from rhetoric to action, and what are the actionable points that we're looking for in order to make a difference in the world today. So without wasting any more time, let me introduce the speakers. The first speaker is Dr. Radhika Batra, the president and founder of Every Infant Matters. So she will do a presentation about, she's got some slides, some pictures, but I want to tell everyone it is not a lecture, it's a conversation. So feel free to chip in, to raise your hands, make comments now, later, whatever we want. Apart from Radhika, we've got some other very interesting, exciting speakers from very different backgrounds. We are honored to have with us today Professor Ravi Anupindi from the Stephen Ross School of Business, University of Michigan. He's the chair of the President's Advisory Committee on Labor Standards and Human Rights. He's a research fellow at the William Davidson Institute, a faculty associate at the Institute of Health Policy and Innovation, Michigan Global Reach, the Urban Institute, and a Colonel William G. N. Ansi Svetlich, Professor of Operations, Research, and Management. So now with this long list of achievements, you can understand what he's going to talk about is very different from what Radhika is going to say. We also have with us Ekpenyong Effiong, all the way from Nigeria. He's the founder and president of Jeksumi Foundation, into humanitarian and health services on a mission to train 1 million community volunteers across African continent. He's also the country director and director African partnerships for Every Infant Matters of India. Sunesh Jain. He is a very important person in the lives of so many millions of people in India who need life-saving essential vitamins and other commodities. He is the president of Vitamin Angels India, and for the past 2 decades, he has been playing various leadership roles, building institutions, teams, funding, and impact. He is passionate about preventable deaths and disability. Preventable deaths, and this is why we are here today. Let's prevent deaths, let's prevent hunger. So over to the first speaker. Radhika, are you there? Let's hear from Radhika.
Hi, everyone. Hi. Thank you so much for giving us this opportunity to speak on this session for catalyzing change. And I'll be sharing some slides. So let me just share my screen. Are the slides visible?
Yeah.
And are they changing?
Yeah.
Yes. So hi, everybody. I'm Dr. Radhika Batra. I'm the founder and president of Every Infant Matters. And of course, as you all know about Every Infant Matters, we work in a lot of areas pertaining to hunger and malnutrition, and now of late in COVID relief. And we're working across 4 countries in 3 continents. And I'm going to be giving you a brief outline about what we do and how we tackle hunger, which is purely a travesty of justice in our view. So we all know this fact that 1 million hungry children become blind every year, and the reason for this is vitamin A deficiency. Now vitamin A is something that all of us, you and I, and all the the well-to-do children who are born and brought up in good homes get from good food like eggs, fish, chicken, milk, butter. And the children who are marginalized, whose parents can't afford this good quality food, they suffer through a condition known as vitamin A deficiency. 250 million children in the world every year suffer from this deficiency, out of which 1 million succumb to irreversible blindness. And that is what is a pure travesty of justice in our opinion. Right. So 250 million children suffer from vitamin A deficiency and are at risk, out of which 1 million ultimately become blind. This vitamin A deficiency occurs because daily diet of children is deficient in vitamin A in good quality foods. There's no milk, no butter, no eggs or cheese. There's a loss of nutrients because of worm infestations and diarrhea. And 880 million children in the world suffer from this worm infestation. 20 million newborns have a low birth weight and are at risk for the consequences that occur with low birth weight babies, both immediate and long term. Immediate, of course, being neonatal mortality, infant death, sepsis, jaundice, brain damage, and the long term being obesity and other lifestyle diseases. So 20 million newborns every year born with a low birth weight, they ultimately add to the health burden of the world, and they add to the increasing burden of lifestyle diseases like diabetes, obesity, and metabolic syndrome. So coming to hunger again, hunger is not just about feeling hungry. Hunger leads to a large number of micronutrient deficiencies, which cause these consequences like stunting, recurrent infections, rickets and anemia, poor school performance, and ultimately irreversible blindness. We're going to stress on recurrent infection here because we know the world is reeling under a pandemic, and lack of vitamin A makes these children more susceptible to COVID-19. The bad nutritional status makes them more susceptible to succumb to COVID-19 and its complications, and also leads to mortality due to COVID. So this is a very important point in the current scenario. Our projects, of course, prevent hunger and its serious consequences. We have projects that promote nutrition. We are giving 2 drops of vitamin A 6 months apart to prevent this irreversible blindness. We are deworming children alongside giving them the vitamin A. And this helps in proper absorption of the vitamin A. It also helps in tackling the worm infestations and its varied spectrum of problems that comes with it. We give holistic health. We promote a holistic health program where we educate mothers and parents on the importance of breastfeeding. We dispel harmful myths. We promote good practices of childhood like hygiene and hand washing. We distribute prenatal vitamins to pregnant women and tackle that problem of low birth weight that we spoke about. So we believe that, good nutrition starts from the first 1,000 days of life. That means 9 months in the womb and the next 300 outside. So this problem of bad nutrition starts from within the womb, and children develop a condition known as intrauterine growth retardation. So to tackle that and to even help the health of the mother, to help her regain her health, to reduce maternal mortality, these prenatal vitamins are of supreme importance. And of course, we promote nutrition at low cost, where we encourage mothers to give children food items which are low in cost and high in nutritional value. For instance, bananas and eggs, which are very cheap to procure, but very, very high nutritionally. Right. We have a few other projects going on, like we promote gender equality, we prevent stigma and tuberculosis. We prevent stigma and discrimination to those with tuberculosis, HIV, or blindness. And of course, in the last 1.5 years, we've been massively focusing our energies on COVID-19 relief. COVID-19 relief, just in a few lines, I'd like to speak about it because, India is in the worst humanitarian crisis of I think the last many 100 years, and we're completely facing it's like an apocalyptic situation in the country right now, specifically in Delhi. I cannot tell you how bad it is. So with COVID-19, we started off in March of 2020 on a very small scale by distributing masks and sanitizers to the needy. And we scaled it up to include, once the lockdown happened in April of 2020, we started distributing grocery kits to the migrant workers and the daily wages who were stranded away from home and were starving. We also did a lot of PPE distribution for healthcare workers all through 2020. And in the second wave, which has hit almost a month ago now, we've been doing this. We've started an initiative called the COVID Task Force. It's called COVID Task Force 2021. It's a 24-hour support group for citizens of India. And we have a dedicated bunch of volunteers, doctors, professionals who are constantly looking out for the helpless people of India, providing them hospital beds, helping them procure medications, helping them procure oxygen cylinders at odd hours, just being a pillar of support for what the people need, when the people need, without, thinking twice of any kind of political red tape or anything. Nothing is stopping us from helping these people, is what I mean to say. So COVID Task Force is something we've been doing for the last 1 month. We've succeeded in helping almost 800 people in getting medical consultations, almost 300 hospital beds, almost 100 beds with ventilators, many oxygen cylinders, food packets, a lot of things. Yeah. So coming back to Every Infant Matters, Every Infant Matters is based, it leverages the power of partnerships, and we have a high impact, replicable and scalable model. Our primary partnership is with a US-based organization known as Vitamin Angels, who are providing free medicines in 70 countries. And our implementing partners are in India, Kenya, Nigeria, Dominican Republic, and in Rwanda. And our partnerships in India are with the Indian Medical Association, the religious groups, local grassroots NGOs, etc. Right. So this is how partnerships have helped us. We've got free medications worth almost $1 million, and we've been able to utilize established last miles in 4 countries. We've been able to deliver a low-cost, high-impact model. We've been able to reach the needy at the very last mile. We work in slums, villages, orphanages, construction sites. We conduct health outreach camps. We serve homeless children. We distribute through charitable clinics, etc. So this is just a picture of our last mile delivery model that we are, focusing on here at Every Infant Matters. These are volunteers who went down Calabar River in Nigeria, medicines to a far off island, a village which was on an island. It's just some camps we did in January, where we did 225 camps simultaneously on the same day, and almost 17,500 patients were, given health checkups, and 4,500 children were given vitamin A. So we have a very high social return on investment, 1:72, which means that for every dollar invested in Every Infant Matters, the return is worth $72 US. And so again, coming back to COVID-19 relief, we've done distributions in 4 countries and 3 continents, protective equipment, COVID task force. I've already spoken about that. And COVID has, of course, unmasked the hunger pandemic, and we've been giving groceries to combat this problem. We've been helping the migrant workers, the homeless, the jobless, the hungry. Right. Just this fun project we did where we distributed chocolates to COVID warriors and to homeless children. Yeah, and also we worked with the tribals all throughout the pandemic, and we gave groceries and ration kits to tribals. There's this tribe in Uttar Pradesh called Musahar tribe, who are so marginalized that they sometimes have to eat rats, and the lockdown just made their condition so much more worse. Coming to something interesting, it's called the Million Meals Project, and this is another part of the COVID relief program that we started in the second wave. And of course, once the second part of the lockdown happened, again people were stuck outside their hometowns. They were not able to, the daily wages were stuck without money, and they were starving, they didn't have food to eat. So we are distributing fresh home-cooked meals to almost 1,000 children a day in 4 to 5 slum areas of New Delhi, and we're planning to scale this up to other areas in the country as soon as possible. But it's been, I think, a fortnight now. It's been 14 days, and this project has been going strong. We've fed almost 700 to 1,000 hungry people a day. Right. So more about COVID relief. We've been helping the girls in Africa who were suffering from so much poverty that they had to indulge in transactional sexual activities to get money to buy and procure essential items like sanitary napkins and food. So we've been helping them by giving them the essential items, food packets, sanitary napkins. We've been preventing teenage pregnancy, and we've been preventing illegal abortions and pelvic infections by, by counseling them, and also by, not letting them indulge in these activities. The need, of course, now is we need to, make our messages and our work known worldwide. We need to raise funds and have a sustainable model. We need replication in several other countries, in the migrant areas, in indigenous people. And with your support, of course, the fight would go on, and no child would ever have to go hungry if, we can do what we are set out to do. Thank you.
Okay, so thank you, Radhika. Now, should I hand over to Ravi, or should I just ask the audience for any comments, any thoughts, anything that comes to their mind? And I think Yasmin is there to facilitate this. Yasmin, if you can help us. Specifically, I'd like to hear from Dr. Minali Goel. Minali Goel is a very senior obstetrician from Mumbai, New Delhi, a lady of very high repute. And she spent a life with the serving women, marginalized women. She's an integral part of the Federation of the Obstetricians and Gynecologists of India. And she's done sterling work for this country. Minali, are you there? I was wondering if we could have your thoughts. Is it permitted to ask questions from the audience, Yasmin? Okay, I'm not sure if she can hear me.
Yes, I can.
Oh, Minali, good. Love to meet you, lovely Dr. Goel. So you've heard what this is all about. Do you have any comments or any thoughts?
No, I think you're doing great work, and especially at this time of COVID, where large sections of the society are having immense problems in India, and even small steps to and small contributions in any way will go a long way to help the marginalized society, and so I think you're doing great work.
Yeah, thank you, Minali. The challenge is that some people actually accuse us of taking small steps. They say, how many people can you feed? Is it sustainable? And then these are the points to ponder upon. And in the breakout sessions, I think we are going to do just that. So is there anyone else who would like to comment over here before we go on to the next speaker? Mohan Jain is there from the US, from the India Development Coalition of America. Mohanji? I'm not sure.
Hello.
Hi,
Namaste.
Mohan.
Good morning.
Good morning.
Evening.
You're from Chicago.
Yes. So congratulations.
What are your thoughts on hunger, and what is America doing? Indians in America
is doing a lot of things. They are sending a lot of stuff. We are also working on it. We got your proposal. We are working on it, and we're hoping to send something soon. So let's see. And you're doing great work, and I'm glad to know that Radhika is involved in this big job. And we will try to work with you and do as much as we can from here. And our government is doing, private sector is working. They are sending things. So all help is coming from America to take care of the problems.
Yeah,
okay.
I think what you've said is very apt, that we all have to be together. And
yes.
Everyone has to take the small steps. What Minali was saying, small steps, but so many small steps will be a giant leap for mankind.
Yeah, I was on a White House briefing last week where the National Security Advisor and Surgeon General at the brief what America is doing, going to do for India. And we were happy that they have now committed fully to do whatever is needed. And we hope that things should be getting better soon. And of course, there are a lot of sad news we are getting from India. Even today we got somebody passed away. So it's very sad, but every day is happening. But hopefully we'll do what we can. Okay, thank you and congratulations to you and Radhika and everybody.
So basically at a personal level, at a political level, everyone has to be there. Ravi, let's hear from the expert. Let's hear from Ravi now.
Hi, good morning, good evening, wherever you are. Ravi Anupindi. Thank you, Shelley, for this very kind introduction, and Radhika, really very impressive work. Just a brief introduction. I am a faculty here, and my area of research teaching is operations and supply chain. So really outside of any clinical expertise that I bring to this. And I've been looking into both initiatives in India as well as Africa extensively for the last decade. So I'm not going to take too much time because there is going to be a breakout, etc. So I just want to highlight a few things. What you opened up, Shelley, in your opening comments saying, why is there a hunger problem in general? And are we producing enough food? Of course, we're producing enough food as a world. So if we're producing enough food, then why are people going hungry? So this simple conclusion is that it's a distribution problem, it's an access problem. So it's those kinds of things that I study. And this is true broadly, not just for food, in many, many cases. You look at today, COVID vaccines, it's a distribution problem. It's a last mile problem. Whether it's TB treatment, it's a last mile problem. So developing appropriate structures to efficiently deliver, and I want to emphasize the word on efficiency. I think I've looked at many very well-meaning efforts. People want to do good. There are many people who want to really do very good, a lot of good stuff. But if it can't be done efficiently, it cannot be sustained. So that's kind of something to think about. So bringing in the operational efficiency mindset, understanding all the stakeholders involved. So this is what we mean by supply chain, from where the production of the product, whether it is food or drugs, et cetera, happening, how do you actually get it to the last mile, and then the service delivery component. I think it's very important to kind of think about those things. And the other challenge, once you think through all that stuff, is whatever organization is going to actually do the service delivery, et cetera, how is that organization actually managed? Volunteering is great. The challenge is, I'm not saying you don't need volunteers, you do. The challenge is how do you effectively manage scaled up volunteer groups? I think that's a huge challenge. So if we don't do that, I mean, there was some mention, Shelley, you introduced, somebody later is going to speak about community health workers. And I've looked at a lot of those community health worker initiatives. They're great. I truly believe in community level initiatives. But the challenge there also is how do you actually manage, maybe performance-based or whatever, the large groups of community workers who can make a difference. And I think Radhika, towards the end, you mentioned about scaling and sustainability. So if we don't have, right from the get-go, if we don't think of operational efficiency, the processes for execution, with an eye towards scaling. If we don't think about that, then scaling becomes very hard. Scaling should not be an afterthought. Scaling should be baked into how you deliver service. Because otherwise what happens is you try to innovate into all kinds of bespoke solutions that becomes harder and harder to transfer and scale. So I think that's something to kind of think about for everybody involved in these initiatives, how to actually do that. I mean, I'm not saying these are easy problems. These are difficult problems, but it can be done. And service delivery design matters. I'll just close with one example. Radhika, you mentioned about a lot of different things. And I have studied the self-help group network in Uttar Pradesh. And this is anecdotal. I spent 2-3 days with them almost a decade ago. And every place there is a self-help group. This is run by the Rajiv Gandhi Foundation. It's called the Rajiv Gandhi Mahila Vikas Program. Anecdotally, every place there was a self-help group, there was healthy pregnancy outcomes, institutional delivery. So you kind of think about what's really going on, and this goes back to strengthening the community work, because it is the community that comes together collectively to ensure good outcomes, right? And it's the same delivery system. They still rely on the public health system. So we kind of think about, oh, public health system is bad, it doesn't deliver. Well, we have to think about how we can leverage what is already going on with some innovations at the ground level. So I'm going to close with that, just some brief thoughts, because I know you only have an hour and you have other speakers I would love to hear from in breakout sessions. Over to you, Shelly.
Thank you very much, Ravi. This was so insightful. And as I mentioned right in the beginning, Ravi is going to bring a different perspective to the problem of hunger. So before we go any further, let me call a few more people. We've got Brian here from Kenya, Brian Mukasa. And if Brian can tell us a bit about the situation, because he's been working extensively in the slums, Kibra and what is the other name? I forget, Mukuru. The biggest slums of Africa are there in Kenya. Brian, are you there?
Yes, Dr. Shelley, I can hear you.
So Brian, can you tell us a bit about the situation in your country, specifically overall, an overarching comment about Africa? Then it'll be very interesting for us to know what is happening in the other parts of the world.
Okay, thank you so much, Dr. Shelley. Glad to join this amazing conversation on hunger. So forgive my camera, I'm actually traveling, going back home. So it's a mess over here. So the situation in Africa, specifically Kenya, with the COVID-19 pandemic, today in the morning I was just working, I was just traveling to work, and I met a large crowd of people in the slums. A child was thrown on the sewer line, and this child was thrown by a woman who maybe decided to throw the child away because she made the wrong decision to give birth to this child, and now the child is already dead. And you see, and we were trying to figure out what might have happened. So we came to a conclusion that it might have been hunger, or the mother might have not have the necessary requirements, the necessary basic needs that she would use to raise the kid. So it was very painful, and it was very sad. We couldn't help, and the people were so crowded. So I think in the situation in Africa, due to the hunger, most of our slum dwellers do suffer a lot. With the current situation, the government is trying to provide aid, but the little aid they are providing isn't reaching the common people on the ground. So we, as the NGOs in Kenya, specifically Nairobi, we are trying to influence these people. We are trying to influence the policymakers so that we see if we can adopt a multi-sectoral approach to provide support to the community to address these various ways of protection and prevention of measures. So our approach is we are trying to ensure that our young women and girls are protected in Kenya. And that is what we are majorly doing. And with the support that we are getting from Every Infant Matters, we've managed to reach out to the young women and girls and even children in Kenya. So our situation isn't good at all. And with the current lockdown. Kenya is currently under the third wave, and I know the African countries, some of them are on a partial lockdown. So we are hoping. Can you hear me?
Yes, we can hear you.
Yes, we can hear you.
Yeah. So sorry, we are hoping that soon we will get the people, our leaders, accountable. At times we say that hunger is not caused by the people themselves, but hunger can at times be caused by the people who the majority elect, the people who the compact majority elect here in Africa. So most of our leaders in Africa, we do elect them, but they don't keep their promises when it comes to hunger. So we are trying to, as policymakers, as advocates, we are trying to advocate majorly on the rights of women and on the recognition of our girls, so that we can get the girls to go to school, we can get the girls to get education. And with the lockdown, most of our girls cannot access this internet services, and they cannot even access the sanitary towels due to stigma on COVID-19. So I'd beg to stop from there, because we have a number of speakers. Thank you so much, Dr. Shelley, and to everyone who is contributing. I hope to learn more from you and to get more from your culture. Thank you so much.
Thank you very much, Brian. So I think I would agree there that the role of civil society, one of the roles could be to sort of mobilize advocacy groups to do advocacy with the government, to improve laws and policies in order to prevent hunger. I'm just thinking aloud that, government could be a very big enabler. And if the government cannot reach certain areas at the last mile, the civil society is there. So basically we work as partners to have the best results. Right. So now I see one person, a very interesting person has joined from a very interesting organization. That is called Vitamin Angels. Guru Prasad Hota is there. Am I right, Guru? Guru, are you there?
Yes,
Raise
yes,
your
I'm
hand.
here. Yes,
Okay,
yes.
lovely to meet you, Guru. Please tell us what you're doing, what your organization is doing.
Yeah, I'm Guru Prasad from Vitamin Angels India. So we are basically an organization who provides vitamin A and deworming for the children who are up to 5 years of age, and multivitamins for pregnant women. So we work for evidence-based nutrition intervention in 70 different countries, and this Every Infant Matters is one of our valued program partner to whom we support with vitamin A, deworming for children, and multivitamins for pregnant women. So yeah, I'm really glad to hear all of you, and privileged to. I'm really waiting to hear Dr. Shelley. So yeah. So anybody, if you have any queries or questions about Vitamin Angels, and if you want to join with us, then surely you can let me know, or you can let me know through Dr. Shelley as well. So yeah, glad to meet you all. Yeah.
Thank you very much, Guru. So Vitamin Angels is a US-based organization. It was started by Howard Schiffer, a gentleman from the health profession himself. And he's established this organization only to provide life-saving essential vitamins to hungry people to prevent serious consequences of hunger. And they're there in 70 countries. Their approach is very simple. They work with local implementing partners. And of course, the India team is doing brilliant work, because when you think of the 1 million hungry children who become blind every year, the highest burden, shamefully, is in India. So that is the state of the world. Now, I was thinking, Ravi, perhaps you could summarize what has been discussed up till now, and then we move into some breakout sessions for the next 10, 12 minutes. And Yasmin can break us all into 2 groups.
Yeah, thanks, Shelley. No, I think these are good initiatives. I think what we would love to perhaps focus in the breakout rooms. So what we see from Vitamin Angels is they are providing a lot of the supplies, and then Radhika and your group is basically trying to get them to the beneficiaries. I think it'd be useful to kind of think about what are some of the challenges and how this can be scaled in an efficient way and sustained. I think those are the things I would I would urge the group to discuss in the breakout sessions.
Okay, so I think let's move into two breakout sessions, two groups for the breakout sessions. And Ravi has posed a very important question. How do you make it sustainable? What are the challenges you expect? And how will you mitigate those challenges? So you want to scale solutions for hunger. How do you anticipate you're going to do it? You cannot move from, there's challenges at every step. We started the Million Meals Project with 200 meals, put in my car and distributed in one slum. From there, you move to 1,200 meals. Where is the big car coming from, the big van, the fuel costs, distribution costs? So food may be free, but how do you sustain operations? So there are many such issues that will come to mind. So Yasmin, can we now move into the breakout sessions? I see it's 6:10. And should we meet after another 10 minutes? Okay.
Sure, I'll do it for 10 minutes.
Okay. So Yasmin will randomly divide us into two groups and put us in two rooms. Am I right, Yasmin? Okay. And then we'll have a conversation. And while the conversation is happening, then one person will have to make notes and present it at the end of the session.
So I think everyone is back from the breakout rooms.
Yes. Thank you very much, Yasmin. You did it so smoothly. It's like a brilliant orchestration. Really impressed with your ability.
Truly, so now, without a pitch, you should be a corporate techie.
Absolutely. So the Catalyst 2030 has the highest standard of excellence in anything and everything that they do, whether it's work at grassroots level or it's communication or it's technology. It's really impressive. So now we have Fiona from room 1, and I do not know who's presenting from room 2, but let's have the two people, the speakers from the two rooms come forward and quickly give their views. Who is the spokesperson from room 2? Yasmin, can you help us here? Fiona is from room 1. If you could unmute her and ask her to speak. I'm not able to get through.
Okay, so I'll summarize what we discussed quickly. We started off by talking about the Green Revolution, which has resulted in an immense use of pesticides. And so for sustainability, there's a need for us, especially India, to go into organic farming. I guess globally, because organic farming is more friendly to the environment. And we also had a person from irrigation, a company that deals with irrigation. And irrigation is also important, especially with climate change. So that means we have food available throughout the year as opposed to using rain-fed agriculture. And so another point we talked about is leveraging the supply chain to avert food waste, because we find that we have a lot of farmers producing crops, especially now going with the use of irrigation. So there's a lot of production of food happening, but this food is most of it ends up being wasted. Like a third of the food produced globally ends up being wasted. And why does this happen? It's because of there's a break in the supply chain. So the food is not being distributed to the people in the areas of deficit. So another area we looked at was the private-public partnerships, which would be able to help in sustainability of these programs. So in Kenya, for example, we have a lot of programs that are dealing with food waste, such as solar freeze solar fridges, so that farmers who produce a lot of food can store their foods in these solar storage facilities at a little cost. And even the trucks also have solar enabled, and they have those fridges, and the food can be transported to the areas of deficit using the solar trucks. And all this happens.
Thank you very much, Fiona. Let's hear from someone from room 2. If someone from room 2, we have just 3 minutes left.
I can basically summarize. It's amazing what room one achieved. I mean, that long list that Fiona mentioned, I can't imagine how you guys discussed all those things in 10 minutes, which is a huge feat. The issue of food waste was, this discussion started in our group with, why is that the Food Corporation of India, so much of food that it collects actually rots in those warehouses, and why doesn't it get to where the people need the food? So, so picking up on that, basically, again, similar to what you guys discussed in group 1, it is about a distributional challenge. How do you get the food to the right people? And the other issue then becomes, I think Mr. Mohan Jain added the idea of food banks, because there is a hunger problem in the United States as well. Role of food banks, and how do we kind of set up similar food bank kind of idea in countries where there is a problem. So I think, we didn't come up with solutions. We identified problems with some ideas of solutions, and food banks also have issues here. I mean, there are food banks, and I've been doing a case study on an initiative in the Detroit area, because food banks typically target, it's supply driven. That is, whatever is available, let's send it to people, rather than customer driven. So if you start treating the people who are hungry not as beneficiaries, but as customers, what do they want? What is nutritious for them? And how do you design a system with the beneficiary in mind, not the farmer in mind who has excess food? I think this is a United States context. I don't know how relevant that is for India. But anyway, we didn't discuss that there. This is just a thought that I'm adding. So yeah, we discussed fewer issues in our group than you guys managed to do in group 1. Over to you, Shelley.
So, Ravi, what can we do? We are not governments. We are not very big organizations. We are people. What would you advise? What will be your parting words of wisdom?
Well, I don't know parting words of wisdom. I think what I think is that, yes, all well-meaning work is welcome by people. But I think scaling solutions is a challenge. It's possible if you think about it. So I'm quite familiar with Akshay Patra as an organization in India, which has developed a very scaled model. They serve about 2 million meals every single day, from centralized kitchens to distribution, going into schools. So I think we need to think in terms of those kinds of scaled models. There is a role of community there. The question really is, as I mentioned in my opening remarks, what kinds of systems would actually have any potential for scaling? Otherwise, yeah, definitely in a time of crisis, or many efforts could be considered like a drop in the ocean, not to minimize that, but every drop counts at this point. So once you're post-crisis, how do you begin to make a difference? And for that, there needs to be scaled solutions. Otherwise, I mean, there is nothing. I mean, people who want to do good work, that's great. I think, that's wonderful. They want to contribute. Everybody can contribute in many different ways. But if you really want to make a meaningful difference, then it has to be systems that reach many, many more people. And managing them in a sustainable fashion is always going to be a challenge, but it's possible. Yeah.
Okay, so I'll just add one little thing to what Ravi has said. So let me quote from the Indian scriptures. Sanskrit is one of the most ancient languages of the world. And there's a saying in Sanskrit, Vasudhaiv Kutumbakam, which means the world is one family. And listening to all the discussions, I've been just thinking and pondering that if we step out of our own ivory towers and realize that hunger is a global problem, we have to act locally, work locally, but think globally and think that the entire world is one family. And let us do some proactive steps now to make a difference in the lives of those who are hungry. I think that is the need of the hour. So with this, I say thank you. Thank you very much to Ravi, to Radhika, to all the speakers. Thank you very much to Catalyst 2030 for this golden opportunity. Goodbye and have a wonderful day.
Thank you very much, Dr. Shelly. Thank you. Thank you for your time.
Thank you.